Hello, my name is Sherry, and I am a mother, teacher, librarian, and an advocate that closely works with a child on the autism spectrum. The following presentation, Asperger Syndrome Just a Piece of the Puzzle, will look at a small segment of what makes the spectrum of autism an endless puzzle. My personal, educational, and teaching experiences in this area will allow me to provide you with the advice and guidance, whether you are a parent, fellow educator, or an interested individual. The information I will be providing is that of my own experiences of raising and teaching a son with Asperger's. Throughout the presentation, I will refer to Asperger's and autism as being like a giant puzzle with many unknown pieces. Each distinctive piece of the puzzle makes the child's diagnosis and treatment unique and challenging. The information I provide will guide you through the definition of Asperger syndrome, the characteristics of those whom have been diagnosed with AS, and the strategies we can use as parents and educators to assist in school and at home. The information is just an overview of the ASPE characteristics and some strategies used to help children with Asperger syndrome succeed. The following information comes from years of reading, attending trainings, visiting with medical professionals, and working through the process to find strategies that work. At the end of this presentation, I will provide resources that can be used by both families and educators to gain even more insight into the challenges of raising and teaching a child with Asperger's. What is Asperger syndrome? Well, if we look at the basic definition, Asperger syndrome is a developmental disorder that causes limitations in an individual's social and communicative abilities. This brief definition only gives us a glimpse at what defines Asperger's. Unlike autism, which is diagnosed during a child's early developmental years, Asperger's goes undiagnosed until about the 3rd grade. This is the time when social immaturity begins to develop and awkwardness in societal practices and communication becomes noticeable. Prior to this, children can get away with exhibiting such differences as being labeled immature and inattentive. AS falls on the higher end of the spectrum because students with Asperger's do have the ability to verbally communicate. They just do so in an awkward and/or inappropriate manner. Included in the defining qualities of those with Asperger's are the difficulties in being able to complete daily tasks at home and in school, which most complete on autopilot. So why don't we make our own definition, one that provides insight into the syndrome? Asperger's is the inability to socialize, communicate, and successfully navigate in all areas of the individual's everyday world. Before fully understanding how some individuals could go into adulthood before getting diagnosed, we need to look at the short timeline of Asperger's compared to other neurological and developmental conditions. In 1944, an Austrian pediatrician by the name of Dr. Hans Asperger began to notice similarities between some of his patients. The patients all had a defining quality of being very intrinsic and self-centered, but not with what most consider normal selfishness traits. They preferred to keep to themselves, exhibited gross motor awkwardness, had no cognitive delays, and a very advanced vocabulary. While Dr. Asperger continued his research in Austria, a psychiatrist by the name of Dr. Leo Kanner was conducting similar research in the States. A research professor at Johns Hopkins University, Dr. Kanner was focused on the delays seen in children within the area of socializing and communicating. It was during the 50s and 60s when Dr. Kanner's research of autism became an accepted diagnosis for children displaying delays in these areas. Dr. Asperger's years of research on children that had characteristics similar to autism, but yet without the delays from birth, went undiscovered until 1981. It was at this time, years after his death, that Dr. Asperger's research and findings had been published by Dr. Laura Wing. That brings us to 1994, when the diagnostic criteria for Asperger's became accepted by the American Psychiatric Association. Now, just 12 to 13 years later, we can begin to understand the unique makeup of these very special individuals. Asperger syndrome, also known as Asperger disorder, is present from birth and causes limitations in social and communicative development throughout life. The brain size and shape is larger and slightly more rounded in the frontal and temporal regions in individuals with Asperger's. Research is currently being conducted to determine when these variations in brain size occur during gestation. Due to the developmental stages affected, some individuals move throughout their childhood and into adulthood before being diagnosed. As we learned while previewing the timeline, the idea of individuals not being diagnosed until they are in their 30s or 40s is easily understood. Those that have gone through childhood and some of their adult life have had to deal with the feelings of being misunderstood, odd, or labeled troubled youth due to their actions. It is because of these individuals we can see that with proper diagnosis at a younger age, we can begin to work towards figuring out ways to intervene and help the social and communicative process effectively develop. As we begin to look at children and the processes they go through when developing social and communicative skills, we see the need to step in and assist children with Asperger's as early as possible. Like I said earlier, this prognosis cannot really be made until the children reach an age where social and communicative norms are expected. During the early years, children tend to be more isolated than others, not needing the same type of play and interaction as those around them. They tend to speak over the heads of their peers. As a kindergartner, my own son had the vocabulary of a third grader and could carry on scientific conversations with adults. Children his age would ask me, "Why does he talk that way?" or "Why is he always talking about the same thing?" As an educator and mother, I knew that he had differences, but others around him would just say, "Oh my, he is so smart for his age." It was not until the third grade that his differences really became noticeable. The reason this is such a magic grade and age is that this is when children begin to display a bit more maturity and social interaction takes off. At this point, a child with Asperger traits begins to look immature when compared to other children. Their behaviors and mannerisms do not coincide with their average to above average ability levels. The awkwardness makes them begin to stand out among their peers. Figuring out ways to help a child with Asperger's can be like untangling a knot. This is because no two children with Asperger's are alike. They are like snowflakes or fingerprints, each unique in their differences. The traits one child exhibits will be different in some way to that of another child with Asperger's. This is one of the challenging things about working with any child with Asperger's, or anywhere on the autism spectrum. We must consistently be learning and adapting our strategies to meet their distinctive needs. With that said, it is important to know that children with Asperger's are very special, and through repetition, patience, and dedication, they can be taught skills to compensate for their differences. Everyone who is involved in the child's life needs to be on the same page and willing to work collaboratively to ensure success. There will be celebrated gains, backslides, and constant reflection on the adaptations being made for the child. Some of the behaviors will be easy to fix, while others will be ones they have shown since their early years. Just keep in mind that what works for one child may not work for the other, and that your devotion will be challenged at times. Working with a child with Asperger's is not an easy job, but the moments of growth and success make it worth the struggles. What are some of the traits individuals with Asperger's display? The first trait that I will address is impaired social interaction, which inhibits the child's ability to interact effectively in social situations. The second trait will focus on impaired communication skills. This impairment hinders a child's ability to communicate in socially acceptable ways and/or express emotions. An unusual response to sensory stimulation is the third trait I will discuss. This trait really varies from child to child and is an underlying factor in how they react to their environment. The fourth trait is the repetitive behaviors. The focus of this trait is the importance of schedules for a child with Asperger's and the anxiety and behavioral challenges related to this need for structure. The fifth and final trait is about interests that seem odd or obsessive. The odd and or obsessive interest in a limited range of subjects differs from a child to child. These focused interests need to be nurtured in ways that assist the child, not impede their development. Over the next few slides, I will provide a more in-depth look at information on each of these traits. I will also address some ways to help your child or a child you work with begin to overcome these obstacles. The first trait that I will discuss in depth is the impaired social interaction. This begins to be noticeable as the child reaches preschool, kindergarten age. During this time, children begin to learn social and communication skills with peers. They learn what acceptable and unacceptable interactions are and begin to leave parallel play behind for a more interactive play. One attribute you will notice is a lack in the ability to display socially acceptable manners, graces. The child may have a play date, and the entire time they play alone and do not interact with the other child. A second attribute will be with how they learn, perceive, and then apply social rules. When this occurs, the child tends to be rigid in following the steps or rules, and will go as far as becoming the rule police for peers. Another attribute that falls under this category is the inability to alter schedules. Routine is very important for these children, and the slightest changes can cause them major distress. These are not the only mannerisms your child may show, but they seem to be very common to some degree among those with Asperger's. An example I can share is when my son had his first outing with a friend. Please keep in mind this was a very big deal because he was in 5th grade when an outing with a friend finally took place. I began role-playing and preparing my son weeks before the event. We would spend time going over how he was to communicate with a guest when he takes them somewhere, all the way down to doing what the guest would like to do at the event. Even with all the planning, my son still needed told that someone was talking to him, and there was frustration over him becoming overly preoccupied with puzzles he was trying to solve. Overall, it was a learning experience for us all. So what can be done to help children with their social interactions? We can begin by keeping everything as structured as your days allow. If there are any changes to the schedule, prepping the child ahead of time will ease the process. This should begin no later than the day before the change will occur, if possible. Life has many unexpected events, so use these situations to your advantage. Reassure your child that they will be fine and keep giving them the support as the events unfold. There may be resistance and frustration, but over time your child will begin to learn to adapt in a way that will fit their needs. The need to live life in such a structured way helps in managing the anxiety and overstimulation that Aspie children feel with the unknown. This usually is the reason why they will become the rule police at home, in school, or in the community. Just remember, a child with Asperger's is not being rude on purpose when they point out loudly in a store that the person in the express lane has more than 15 items. They are just following the structure and rules that are put in place for that situation and cannot grasp why someone would not do exactly what the sign says. Before I begin talking about the second trait, I want you to know I will be using the word conversation in the description, but not as a two-way interaction. Most of the conversations will occur as them talking excessively about one topic without giving the other person a chance to speak. With that explained, let us look at impaired communication skills. This communicative impairment does not cause a delay or lack of language, but rather the opposite. A child with Asperger's usually develops language skills very early and has expanded vocabulary. In an earlier slide, I gave an example of my son and how he sounded like a little adult carrying on full, one-sided conversations about animals. You may also find it hard to keep up with the conversation as they move from one topic to the next with no warning. Although there is an advanced language development, it is noticeable that the conversations they have are specific to their area of interest, and not give and take. It is difficult for them to hold conversations outside of their interest area, and changing this process takes years of patience, practice, modeling, and more patience.